I myself, I was 327 pounds at my heaviest, smoking a pack a day, eating just like crap. And that's all it really took. I had help along the way, but it was just one little step at a time. Same goes for strengthening, training, stretching, all of these things. It's just one step at a time. But that's the idea. It doesn't have to be a drastic change. We're not expecting people to all of a sudden be stretching for hours at a time. What's going on, guys? Nick here from MotionRX Mobility Services. We're here on 67th Avenue in the 101 freeway. We're gonna walk you through a little bit today and kind of tell you a little bit about some of the service that we have here in the clinic. We got a lot of other great things, especially for you CrossFitters who are really dealing with any pain, chronic injury, those types of things. We've got some great services, some great things to offer you so that this way we can get you back to performing your best. I'm with MotionRX. We do mobility, we do assisted stretching services, scraping, cupping, myofascial release. We also do exercise programming, nutrition coaching, all of the things that you need to be performing at your best. So I'm gonna show you over here at Revive. You'll see the sign Revive outside. Revive Wellness and Rejuvenation was started by Dr. Graham a few years ago, and now our PA Allie has taken that over, Allie Burkett, and she is with Legion of Power CrossFit out in Glendale off of 91st Avenue. They do the GLP-1, semaglutide, tirzepatide, hormone replacement therapy like TRT, supervised weight loss. They've got injections such as the PRP, the platelet-rich plasma, umbilical cord tissue, exosome therapy, stem cell therapy. They've also got for you guys sexual wellness therapy as well as for women. So make sure that you guys come check this out. It's one of the best things that has recently come to the market has been the peptide therapy. It's actually something that I have gone through as well. I've had injuries to my shoulder, I've had injuries to my knee, and helping with that tissue rebuild has been something that has been extraordinarily beneficial with being able to avoid some of those more invasive type surgeries, operations. So it's really been able to help me get back onto my feet and really stay healthy and to stay active and to keep pushing the way that I want to in the gym. That's all of Revive. Dr. Burl Bachowski is the owner of AdjustMe Chiropractic. He's got a great sense of feel for where the body's misaligned. He's really big on finding the cause and treating the cause, not just treating the problem. He's got 2 adjustment rooms here. First room is up in the front here. In the back, he's also got a really great traction setup as well too. Things like any traumatic injuries, any impact injuries. I myself had a car accident, was having a lot of numbness in my hands. Went through some traction, got some adjustments from Dr. Burl. It was absolutely fantastic. So both of them, between Ali and Dr. Burl, have been able to keep me put back together as well. This is the traction room, traction and adjustment. This big old contraption that you'll see inside of the room is the traction table. This is great for lumbar traction, great for cervical traction. When I went through it, I was doing some cervical traction and really helped to open up the cervical spine where I had some compressed discs. Just eliminated the tingles, eliminated the numbness. Highly recommend looking into that if you're experiencing any type of radiating down the arms, down the legs. A really great option here, so definitely come check that out. Over here we have just the IV drip room. Got some nice cushy chairs here for everybody when they're coming in to do their IV drips and any blood draws that they may be needing for any labs that may be requested. One thing that I highly recommend is to stay on top of blood levels, hormone levels, making sure that everything is running smoothly. Get that checked out, especially as we start to get older into our 30s, 40s, 50s, and still trying to perform at a high level. It's very, very important that we're continually staying on top of every single aspect that is involved in our performance. I'm gonna walk you over into here where Revive does all of their matching. One great thing that they also have begun doing is the OmniWave. Great for men with ED issues, but the other thing that has been really beneficial with the OmniWave is just helping to alleviate inflammation, get really good circulation flowing to the areas. This is Raquel. She's phenomenal. She's here with Revive, so she handles a lot of the recovery, the regenerative medicine.
The OmniWave machine helps with injuries, musculoskeletal-wise, either in their shoulders or knees, lower back. It actually helps promote your own growth factors to reach the area of injury, break down any scar tissue, and it's a very non-invasive, subtle way to help with any injury that you might be having. We've seen great results with this. People have actually, with just even one session, has increased their mobility, whether it's abduction, extension, certainly helps with all that.
It's literally pain-free. Feels a little warm, but man, let me tell you, it really is great for any chronic pain, chronic inflammation, or if you really just need to start getting some circulation to an area. Really, really fantastic. They also do the PRP treatments, and they'll draw your blood, spin it down in a centrifuge, separate the platelet-rich plasma, and inject it back into the area so that the body can begin to heal itself, kind of like a kickstart. If you've gone and maybe got some imaging done and they're showing a partial tear and possibly recommending surgery and you're not quite ready for that yet, PRP, stem cell injection, pair that up with some peptide therapy, that's the road to recovery right there. This is my little cave in here. What I do in here, it's all, one-on-one, hands-on assisted stretching therapy. I'm also gonna be taking people through deep tissue release, myofascial release, doing some scraping, doing some cupping as well too. Really just breaking down the body and trying to find where those limited spots are, where the limitations are. Your first visit, you come in, we're gonna chat a little bit about what are some of the pains that you've been feeling? What are some of the limitations you've been feeling? When does it hurt? When does it not hurt? What makes it feel worse? What makes it feel better? And really try to get an idea of where the issues are coming from. I'm gonna take you through a little bit of mobility assessment and just try to see exactly where some of those limitations are during movement. And then after that, you're gonna be going right onto the table so this way I can feel exactly what's going on. So my biggest three things, my process is what I hear, what I see, what I feel. And from there, we're gonna start to work into the program of the 3 S's, okay? Stretch, stabilize, strengthen. Okay, that's what I live my life by. I also use a technique that's become very common. Research has shown that it's the most beneficial type of stretching, which is called PNF. And it stands for proprioceptive neuromuscular facilitation. The way that PNF works is that you have 2 walkie-talkies in your muscle, okay? You have what's called the muscle spindle and you have what's called the GTO, the Golgi tendon organ. The muscle spindle is responsible for contracting, firing the muscle, especially when the muscle is being stretched. So the Golgi tendon organ, which sits a little bit closer to the tendon of the muscle, that helps to essentially relax the muscle. When the brain recognizes that we're in a safe space, we can relax, we can go a little bit further, go a little bit deeper. The Golgi tendon helps to initiate that action and we can release into that stretch. You can open up. That's the whole idea behind what PNF essentially is. So going into a little bit about cupping and scraping, if you've never had those services done, cupping was actually created in Korea. What it's been shown to help with is to release inflammation from tissues, to also increase circulation. It's probably the biggest component of cupping, is to really increase circulation into the areas. Cupping kind of became this big thing back when Michael Phelps was in the Olympics and he's got all these, octopus kisses on him and everybody's like, what the heck's that? Another thing that we'll do is use something what's called a massage cup. We'll take the cup, place it, set it, and then rub up and down with the cup. And that suction is going to come up and through, help draw out a lot of inflammation. And then also, again, same thing, it just increased circulation into that area. Some of the biggest areas that we're looking at, definitely the calves, the gastrocs, the soleus. These are big things for CrossFitters, making sure that the Achilles tendon, the hamstring muscles, really working through those, trying to break up tissue and really break up the fascia that surrounds the outside of the tissue as well. What we try to do is break that down and try to get it to set and relax and release. So this way the muscle can actually function the way that it should. The smallest contractile unit of the muscle is called a sarcomere. And within the sarcomere, that's where the contraction happens. So when I want to contract my bicep, my brain tells my muscle, okay, go ahead and contract. So everything slides together. Over time, what can happen is the sarcomeres no longer slide very well. Everything starts to get knotted and starts to get just stuck. So the whole point of doing stretching, scraping, myofascial release, cupping is to help break all of that up. So this way the muscle can function. The 2 things that a healthy muscle needs is extensibility and elasticity. Extensibility is how far the muscle extends. Elasticity is how well that muscle can stretch and then recoil back to its original position. We start to lose both right around that sweet age of 40-ish or so. When muscle mass starts to decrease a little bit, the muscles become a little bit more tough, a little bit more rigid. And so we're losing that elasticity, we're losing that extensibility. So that's why it's so important to keep up on these things. All of those are gonna play into what we do. It just takes one step at a time. But that's the idea. It doesn't have to be a drastic change. We're not expecting people to all of a sudden be stretching for hours at a time. I was 327 pounds at my heaviest, smoking a pack a day, eating just like crap. And that's all it really took. I had help along the way, but it was just one little step at a time. Same goes for strengthening, training, stretching, all of these things. It's just one step at a time. Thanks to AI and Google and ChatGPT, we do a lot of self-diagnosing, and that's okay. Obviously, you want to take it to the next step and finding someone that's going to be able to give you that definitive answer of what's going on. The first step is just walking through the door. And then from there, you got a team of people here just to help figure it all out for you. The 3 of us work in conjunction with one another to determine what people need. I have a patient of mine. She had been experiencing just a lot of knee pain, a lot of issues going on. And she went to Dr. Burrow, had some adjustments, and things slowly started to get better, but Dr. Burrow recognized that she really needed some strengthening. She needed some stretching. So we started doing that. We discussed a little bit about previous injury. We'll come to find out she had actually had a partial tears in the meniscus. And so we started talking a little bit about PRP injections and some peptide therapy for her. I was able to grab Allie, the PA, bring her in and just have a quick conversation. And she, a little bit of chiropractic, some stretching, strengthening, and then also some peptide therapy as well. Now, this woman is actually in her 70s and she was competing in cross country. It was really beneficial to see how the 3 of us could come together and find a really good plan of care. And now she's just, performing at her best. And it's just an incredible thing to see how people can progress without having to go down the line of surgery and having to go under the knife. In some cases, obviously that needs to be the option, but it's good to know that there are other options out there and not having to kind of take that big leap, and also to continue performing, to continue doing the things that you love to do. Maybe back off a little bit, but still continue to progress forward. It's been really great being able to work with these two and to really find great avenues of care for people.